Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook Garard from the nursing department here at Nassau Community College. And today we're going to get an update on how COVID is affecting our local hospitals. In the interest of full disclosure, today's show is being recorded on October 27th, 2021, so all facts discussed are as of this date. Our guest today is Dr. Salvatore Pardo, the chair of the emergency medicine at Long Island Jewish Valley Stream Hospital, part of the Northwell Health system. Dr. Pardo, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much. Thanks for having me.
So first of all, I hope you're doing okay in light of the pandemic. Has it affected you personally?
I think it's affected me personally through work, obviously, and through family members that are at high risk. So I have two children under the age of, one is 10 years old and one is 2 years old. So it's affected us in that way as well.
So we've come a long way in the 18 months as it relates to the stabilization of the infection, the COVID virus. Right. So has this been true in Northwell Health? How many current COVID positive patients approximately do you have?
Well, sometime over the summer, we saw a spike related to the emergence of the Delta variant. It was around that time, around July, that we saw an increase from a baseline of around 2% to about 4% prevalence in the community. And that we saw a little bump in our hospitalizations as well. That has stabilized and now is going in the opposite direction, is going back down. So we had a bump in relation to the Delta variant. I don't have specific numbers. I would say the number is stable. That's
good news. So
yes.
How has treatment, has it changed over the past year and a half, or has your treatment been about the same?
Over the past year, we've done a lot to change the way we treat COVID. We are able to give antibodies, right? And that's mainly preserved for persons that don't need to be hospitalized. So, for example, if you came or you got a positive test, you felt okay, you had a positive test for COVID, and you had some minor eligibility criteria, let's say age or a chronic disease, let's say, you would be eligible to get the antibodies, and we would be able to do that for you either at the hospital in the emergency room or on an outpatient basis. And we would tailor that to similar to like an appointment to be done, during the day at your convenience. We've been able to do that. We've come a long way from the very early stages of COVID in regard to what works. We know that steroids work. We know that things that are not approved don't work, such as the most recent veterinary medicine, hydroxychloroquine, early in the pandemic. We knew that didn't work. So we've strayed from those treatments and tailored to things that do work. Remdesivir works, or we found to be helpful. The antibodies work. That we've found that to be helpful.
I know the mortality rates have gone down significantly with COVID. What would you give the account of why that happened or why that is occurring, where we're not seeing the numbers, the death toll with the virus?
Well, I just mentioned some of the adjunctive treatments that we're able to find. That has contributed a lot. We understand the disease a little bit better. I do believe that the vaccinations have helped. So we have less severe disease due to vaccination. So just want to reiterate, the vaccine doesn't prevent COVID. It prevents severe disease and hospitalizations and, of course, death. So I think those things have contributed to the decrease in death rate. that we're seeing across the health system and across the country.
Would you say with the vaccines, tell me your thought about the differences in the Moderna, obviously the Johnson & Johnson, and the Pfizer. What would you suggest is the most effective? We know, what the studies are showing, that the Moderna and the Pfizer, but what are your thoughts about that?
Well, we know that the Moderna and the Pfizer have very similar platforms, meaning that they're messenger RNA vaccines. We know that they're similar in the sense that you need 2 doses. The Pfizer was available first and Moderna second. And what we're seeing regarding boosters is that, and this is the data that's out of Israel, that the boosters are needed and for certain populations. And the immunity associated with the initial vaccination appears to be more effective from the Moderna vaccine, especially when you look at it over a long period of time. So it seems that the Pfizer immunity lasts not as long as the Moderna, and at least from the data that we do have. Now, the third vaccine, the Johnson & Johnson or the Jansen Vaccine, is a 1-dose vaccine. We found that from the beginning, we knew that it wasn't as effective as Moderna and the Pfizer. And what we're talking about is efficacy of 90 to 95% versus an efficacy of around 60 to 70% for the Johnson & Johnson. And now what we're learning is that the recommendation is to get a second dose of the Johnson & Johnson to bring it up to speed. The Johnson & Johnson uses a different platform that I'm not going to get into here, but it is not a messenger RNA vaccine. It's also a little bit better tolerated from a side effect standpoint.
So what are your thoughts about the boosters, particularly as it relates to those who are vulnerable, like your elderly population or those that have chronic illness? What are your feelings about boosters?
I will tell you how I feel by how I act. I got my booster vaccine. I'm a healthcare worker. I'm in the front line, so I got my booster vaccine. I got the Pfizer initially, and so I got my Pfizer booster. Both my parents got Pfizer, and they asked me the other day, should they get the booster? I said yes. So the data that we do know is that the boosters are effective and prolong the effectiveness of the vaccine in general. I support them. My parents are elderly. My dad's 90. My mom's 82. I'm a frontline healthcare worker or an essential worker. Those people should seek out the booster.
So is there a time frame with the booster? If you've had the immunization, be it Moderna or the Pfizer, is there a time frame with the booster in terms of when you should get the booster? How many boosters you should get?
Yeah, so they're recommending 6 months from the initial vaccine. So 6 months is the number that they are recommending since your last dose. So if you've got it 4 months ago, you probably have a couple of months to wait till you get your booster.
So in terms of documentation of the first and second dose of your vaccine, the booster should also be recorded on that same card. How are we handling documentation of the booster?
So I think all the vaccines get uploaded into a general database that New York State has, and then you should have your vaccine card from your original, and you should get that completed as your third dose. Myself, I laminated my vaccine card, so I wasn't unable to do that. But I could also, because of my employer, I could have access to it anytime I want, like my record of immunization.
So I read that about 1,400 Northwell employees are terminated after the healthcare worker vaccine mandate went into effect. So I'm not sure some of these coworkers and maybe even your friends find it troubling that this is a mandate that we have to be vaccinated. What is your personal opinion about your position on not getting the vaccine? Well,
obviously it's a choice. And the word mandate makes it seem that there's not a choice. So I think the memory, for some reason, is short. You think about March of 2020, what New York State and the region went through in the metropolitan area, including Long Island. Things were very dire for many, many of the people that live around us. From a healthcare perspective, the mandate is needed. I don't really waver on that at all. Of course, politically speaking, it's not what I get paid for. I can understand why people would have issue with a legal mandate because it infringes on their rights. However, it is a choice. Everything that we do has consequences. So, you could choose to exceed the speed limit. You could choose to carry an unlicensed gun. You could choose to do many things that are legally bound. However, you just have to deal with the consequences. It just so happens that Northwell's consequences that you would not be able to work within the health system. That is the decision that was made. I happen to agree with it. Unfortunately, people had to make difficult decisions. And if it means enough to that individual that they would forego their employment, that is a decision that had to be made.
Because the feeling is that is not just you are susceptible now to the COVID, but that you can also infect someone else. Is that the thought?
Right. So I think there is a community argument here, right? Mm-hmm. So what's better for everybody? Mr. Seplow, he was my social studies teacher in 10th grade, and he said very succinctly, and it's probably one of the few things I remember from high school, he said, your rights go as far as the other person's nose, right? So once you start infringing on other people's quality of life, guess what? There is something that needs to be accounted for there. So I still remember that quote, and I do think that applies. People will talk about, well, I think I can recover quickly. I think I will have a mild course of disease. I think I will do well, even if I contract COVID. However, the person that you're sitting next to may not. And this is a communicable disease. It's not based on what the individual is best for the individual. Really, what the idea is kind of like to get everybody safe so everybody could go back to their normal activities. And I mentioned earlier, if I may expand on that, like I have children, they cannot be vaccinated. I worry about this every day. They go to school, they go to a party, they go here, they go there, and they can, they're in contact with people and they can't really protect themselves other than me isolating them from the rest of society. That's a good example how I'm vaccinated. I know I'll be okay, but I do make choices based upon my children because of what's best for them. So it goes along those lines.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook Garard, and today we're getting an update on how COVID is affecting our local hospitals from Dr. Salvatore Pardo, the chair of emergency medicine at Long Island Jewish Valley Stream Hospital, a part of Northwell Health system. So we keep hearing how we may, in days or weeks, we're away from children being approved for getting the Pfizer COVID vaccine. Have you seen any of the research, and have you have an opinion? I know you've been talking about your own children, but booking these appointments for children, have you seen any of this happen? And how soon? Is there anything on the timeline for our children?
So I think recently the vaccine has been approved for children ages 5 to 12. And we should be seeing the availability of that vaccine shortly. So I think it's very important and kind of very helpful for children to do that. The dose is a little bit is different. It's about, and I have data about the Pfizer vaccine. It's about 1/3 the dose of adult doses. It's not the full dose that the adults have gotten, based upon, obviously, they're smaller. I haven't seen the research personally. But I rely on kind of the FDA and the CDC to tell us what the recommendations are. I know there's been a lot of discussion about it and a lot of trials.
So we can get our flu shot and the COVID shot at the same time. Why is that possible?
Well, there are two different types of vaccines. Number one, there are two different vaccines. Often, if you remember, if you have small day children, often you would get vaccines on the same day for different diseases. The same thing applies here. It's not dangerous to do it at the same time. I got my flu shot a week apart, but that was because I didn't have access to them at the same time. I think, I got one in one arm and another in the other. So because my arm gets a little sore when I get any vaccine. There's not a recommendation officially to get it on separately, but certainly people don't want to deal with two shots at the same time. It's understandable. So I think the question was, why is that possible? It's possible because they're two different vaccines, and there's no correlation to be able to do more than one at a time.
So do you think or foresee the COVID vaccine is eventually being given annually, similar to the flu vaccine that we currently get?
That's a difficult question. So going into my microbiology courses, the flu vaccine is actually a different vaccine every year, right? So for those of you who remember H1N1, and then there was H2N3, those are all variants of the influenza virus. That is why you need a different vaccine every year for the flu. That is based on the prevalence of what's, globally, right, what's emerging. So can I see it happening? Yes. We will see how this coronavirus, or particular coronavirus, this novel coronavirus, behaves. We will have to see how it transforms. Are we going to see a different strain as we see the Delta strain, Gamma? And then we'd have to see how that particular strain responds to the vaccine. So I could see that if there's a more prevalent strain out there that does not respond to the current vaccine, you'll probably need a different vaccine. But that remains to be seen, and I'm sure our infectious disease people are keeping a very close eye on that, and that's why we keep on hearing about these variants. Fortunately enough, the Delta variant is responding to the current vaccine in a good way. So that's good news.
It is.
The idea is to eradicate this particular strain. This way we won't have to make changes every year. But that remains to be seen. We'll see what happens.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook Garard, and today we're getting an update on how COVID is affecting our local hospitals from Dr. Salvatore Pardo, the chair of emergency medicine at Long Island Jewish Valley Stream Hospital, part of Northwell Health system. So, I hear in the community people saying, well, I'm social distancing, I'm wearing my mask, I'm doing everything right. Why do I even have to get the flu vaccine? If I'm doing all of this right and I'm covering, I'm decreasing the spread of the flu virus in the first place. So why do I have to even get the flu vaccine? What are your thoughts about that?
I am a pro-vaxxer. Hear about all the anti-vaxxers. It's a preference.
Yeah.
What do I think about it?
Yeah.
If you want to go around wearing a mask and doing all that stuff all the time, and it's really about doing the right thing, in my opinion. We practice safe practices anyway. Hand washing, wearing a mask when needed in the hospital. That's what flu vaccine provides, is a little extra protection. Even if we do get it, we won't be as sick. It's not as easily transmissible. So there's a lot of reasons about, love thy neighbor. It's about your neighbor and the people around you that you're really helping when you get vaccinated. It's not necessarily about you per se. I think we have to get away from the individual and what's best for me as an individual, and we have to worry about those around me. I get vaccinated because I have small children.
Yeah.
I get vaccinated because I have elderly parents. I know that if I get the flu, I'll probably okay and recover. Maybe it will take me a little longer, but it's really about everybody around me. I don't really do this for myself. I do it for my neighbors and loved ones.
So just clarify for us, can you be reinfected with COVID?
We see that, yes. The answer is yes. It's unlikely. You can get, we know that you can get COVID even if you have, the vaccine. And you also can get COVID again if you've had COVID before. The body has an immune system and it's not infallible. It's much less likely to get it again, but it is possible.
So if I have COVID, can I get the vaccination during my infectious disease, during the infectious process of the disease? Can I get the vaccination then, or do I have to wait?
The recommendation is that you wait until you're symptom-free. I'm not going to speak to exactly why, but because I don't want to say something that's not true. Mm. But the recommendation is that you don't want to get a vaccine when you're actively ill, because it does generate an immune response, and you don't want to have more than one at the same time. But yeah, but even if you had COVID, the recommendation is to get the vaccine.
So for the physicians and healthcare workers at Northwell, what are you doing regarding patient teaching when patients come in the hospital as it relates to immunizations or just patient care and how they handle themselves once they're discharged from the hospital going home? What are some of the things that you're teaching them to do to decrease the spread of COVID and other infectious diseases?
Right. So every patient that walks through an emergency department or any entry point into the health system, every single patient, if they get an intake process, either by a nurse or a doctor or whomever, are being asked if they're vaccinated. If they're not vaccinated, if they are vaccinated, we kind of document when they were vaccinated. If they're not vaccinated, then we ask them, would you like to be vaccinated today, now, while you're here with us? We in the emergency department at LJ Valley Stream have vaccinated many people who either did not have access or didn't think about it or whatever reason, and they get vaccinated during their visit in the emergency department. Once we make contact with these patients, vaccinated or not, they get instructions on what to do, how to behave, the general things, hand washing, distancing. They have a lot of questions around, how do I protect our loved ones? And you learn how to do that. There's been a lot of discussion around women that are pregnant or breastfeeding, whether the vaccine is safe. And it gives an opportunity for us as caretakers, whether it be a nurse, PA, NP, doctor, to have that conversation that perhaps the individual hasn't had access to the expertise. And I will tell you that overall, the vaccination is very safe. We've had very little bad outcomes from the vaccine alone. Really, remarkably, it has very little downside to getting the vaccine.
So I've also noticed that looking at websites, there are certain places that are really not places to travel to because of the prevalence of COVID there. Is that a part of your intake when patients come into the hospital that you ask questions? Have you traveled? Have you been out of the country? Is that a part of the questioning that you would give or ask potential patients?
Unfortunately, the United States is considered one of those places. I don't think our level of the prevalence locally is better than a lot of places that are considered hotspots. We do ask questions revolving around who they've been around. Do you know anybody who has been infected? But I am sad to say and sad to share with the public that we're not doing that well as a country overall. There's certain areas of the country that are doing better than others. Even in Nassau County, until recently, over the summer, we haven't hit 60% vaccination rate. We still have a prevalence of about 4% in the community. So asking about travel really is not important because I would say we still are in danger locally.
We have a long ways to go ourselves.
Yes. Yeah.
We have a long ways to go ourselves. So if we wanted to get more information on information about COVID or the updated regulations or guidelines, where do we get information as it relates to Northwell?
Northwell has a patient portal that has either direct communication with our patients or the community itself, or it provides the links to the trusted sites such as the CDC and the FDA. The FDA website usually has updates on what they're doing as far as researching and the approval process. The CDC has the latest recommendations based upon people's, the disease itself. That's what we rely upon. Also, the Department of Health, New York State Department of Health has the same links. Frequently, the Northwell sites refer to the New York State Department of Health. I know Northwell has been working very closely with the state to try to make sense of everything and kind of develop and adhere to the recommendations by the CDC.
So you recommend that the public look at all of these major websites for any kind of update that is relevant to COVID and or the variant or any infectious disease?
Yes, I think that's probably the most reliable and up-to-date, well-researched website that you can find. There's a lot of misinformation out there. I would caution looking at your Facebook feed, relying on anecdotal things that you heard from a neighbor third removed. These are all kinds of things that tend to cause confusion in the public. It really requires you to go to the official websites and kind of rely on that data, assuming that you trust those sources.
So what is the one thing, if you had one thing or two words to leave with the audience about COVID and how you see it?
I would say that we do not want this to hang around any longer. From the very beginning, I was a believer in the vaccine would be our path to that. Bridging to the vaccine, hand washing and masks. We have to protect ourselves and each other. And I would say parting words is like when you're making decisions about being vaccinated or how you handle COVID, think about everybody else. You have to think about the people around you and not necessarily what's best for you as an individual, but the people around you is my recommendation. Be thoughtful.
Well said. Thank you for being here, Dr. Salvatore Pardo, the Chair of Emergency Medicine at Long Island Jewish Valley Stream Hospital, part of the Northwell Health system. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
My pleasure. It was a lot of fun, and thanks for including me.
This is Dr. Jeanine Cook Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.